A 68-year-old retired bus driver sat in my office last year and told me something I've heard too many times. He said, "Doc, I've been seeing a little blood when I go to the bathroom. It's been a few weeks. Probably just hemorrhoids." A few weeks, he said it like it was nothing, like he was telling me about a leaky faucet he hadn't gotten around to fixing. By the time he came to me, that little bit of blood had become something much more serious, something that could have been caught early, something that should have been caught early. But he waited, not because he was careless, not because he didn't care about his health. He waited because nobody had ever explained to him what blood in the stool actually means after 60, what it could be, what it probably isn't, and what to do the moment you see it. He's not alone. I have seen dozens of patients just like him. Good people, responsible people, who noticed something and talked themselves out of taking it seriously. Some of them got lucky, some of them didn't. This video exists because of him. And because of every person over 60 who has looked down, seen something alarming, and done nothing because they didn't know what it meant or what to do next. I'm going to walk you through all of it. What causes it, what the different signs mean, when to worry, when not to, and exactly what steps to take. No panic, no guessing, just clarity. What you learn in the next few minutes could be the difference between catching something early and catching it too late. Stay with me. Here's something most people don't realize. After 60, your digestive system is not the same system it was at 40. It looks the same from the outside, but inside, things have changed in ways that matter. The lining of your gut, the delicate tissue that separates what you eat from your bloodstream, becomes thinner with age. The blood vessels embedded in those walls become more fragile. Decades of dietary choices, medications, stress, they all leave a mark. And the microbiome, that enormous colony of bacteria that keeps your digestion running smoothly, shifts in composition as you get older, often in ways that increase inflammation rather than reduce it. Think of it like a pipe that's been running for 60 years. It still works, water still flows through it, but after that many years there are weak spots, small cracks, places where the walls aren't quite as thick or as resilient as they used to be. A little extra pressure in the wrong place and something gives. That's what's happening when you see blood in your stool. Something somewhere in that system has given way. It might be minor. In most cases it is, but it is always your body sending you a signal. And the worst two things you can do with a signal are panic or ignore it. What we're going to do instead is understand it. Because once you know what the different causes are, once you know what to look for and what questions to ask, you go from being afraid to being informed. And informed people make better decisions about their health. By the way, if you're someone who's already thinking about how to support your cardiovascular and digestive health, Cardio Slim Tea is available right now at a special discount. Links on the channel page. Now, let's get into the specifics. Now, the very first thing I want you to understand is this. Not all blood in the stool is the same. And the single most useful clue your body gives you is the color. If the blood is bright red, fresh-looking, typically on the surface of the stool or on the tissue when you wipe, that usually means the source of the bleeding is low in your digestive tract. The rectum, the lower colon. We're talking about things like hemorrhoids, small anal fissures, or polyps sitting near the end of the line. The blood hasn't traveled far, so it still looks like blood. But if what you're seeing is dark, very dark, almost black, with a sticky, tar-like consistency, that tells a very different story. That's called melena, and it means the bleeding is happening much higher up. The stomach, the upper part of the small intestine, possibly a peptic ulcer or something more serious. The blood looks dark because it's been partially digested on its way through the system. It's been traveling a long distance before you ever see it. There's also a middle ground. Dark red or maroon-colored stool can suggest bleeding somewhere in the middle of the tract, the small intestine, or the right side of the colon. Now, I'm not telling you this to frighten you. I'm telling you this so that when you see something you can describe it accurately to your doctor. Not "I saw some blood," but "I saw bright red blood on the tissue," or "my stool was very dark, almost black." That description alone can save days of guessing. It points your doctor in the right direction immediately. Pay attention to the color. It's the first question any gastroenterologist will ask you. Now you'll have the answer ready. Let's talk about the most common cause first, because this is the one most of you are probably hoping it is: hemorrhoids. If you're over 60 and you've seen bright red blood after a bowel movement, there is a very good chance hemorrhoids are the reason. They are far and away the most frequent cause, and they are nothing to be embarrassed about. Most people will deal with them at some point in their lives, and after 60 the numbers go up significantly. So what are they exactly? Hemorrhoids are swollen blood vessels in and around the rectal area. Think of them like varicose veins, but in a place nobody wants to talk about. They develop from straining during bowel movements, sitting for long periods, chronic constipation, or simply from the natural weakening of tissue that comes with age. They can be internal, inside the rectum where you can't see them, or external, where you can feel them. Both can bleed. Usually it's painless, which is why many people notice the blood but don't feel any discomfort and assume it's nothing. And here is exactly where the danger lives, not in the hemorrhoids themselves. Hemorrhoids are manageable. The danger is in the assumption. Because hemorrhoids are so common, people use them as a self-diagnosis. They see blood, they think must be hemorrhoids, and they never get it checked. They never sit in front of a doctor and find out for certain. That assumption has cost people their lives. I've seen it happen. A patient who was sure it was hemorrhoids for a year. It wasn't. Hemorrhoids are the most common cause. They are also the most common excuse for not getting screened. Don't let a likely explanation stop you from getting a certain one. Now we move into the middle ground, the two conditions that sit between harmless and serious, and the reason I want you to know about both of them is that they are incredibly common after 60 and almost never talked about until something goes wrong. The first is colon polyps. These are small growths that form on the inner lining of the colon. Most of them are benign. Most of them cause no symptoms at all. You can have them for years and never know. But here's what makes them important. Over time, certain types of polyps can slowly change. Cell by cell, year by year, they can develop into something that is no longer benign. That process is exactly why colonoscopy screening exists. Not to find cancer, but to find polyps and remove them before they ever get the chance to become cancer. Think of them like small bumps forming on the inside of an old pipe. Catch them early, scrape them off, and the pipe keeps working. Miss them, and they grow. The second is diverticulitis. After 60, many people develop small pouches in the wall of the colon called diverticula. Picture a tire that's been on the road for a long time. Where the rubber has thinned, small bulges push outward. That's what diverticula look like. Most of the time, they sit there quietly and cause no trouble at all. But when one of those pouches gets inflamed or infected, it bleeds, sometimes significantly. That's diverticulitis, and it can come on suddenly with pain, fever, and visible blood in the stool. Both conditions are manageable when caught early, both respond well to treatment, and both become genuinely serious when ignored. The pattern is always the same. The body sends a signal. What matters is whether anyone listens. I need to talk about this one directly, because avoiding it doesn't make it less real, and knowing about it could save your life. Colorectal cancer. Here's the truth most people don't hear often enough. Colorectal cancer, when caught at stage 1, has a survival rate above 90%. Above 90. That is extraordinary. That is one of the most treatable cancers in medicine when it is found early. But when it's caught late, when it's had time to spread, the numbers look completely different. And the difference between those two outcomes often comes down to one thing: whether someone paid attention to the earliest signs. Blood in the stool is one of those signs. Sometimes it's the only sign, and yet I have seen patient after patient who noticed it and waited weeks, months, sometimes longer. Not because they didn't care, but because they assumed it was something else, something harmless. The risk factors are well established. Age over 50, a family history of colon cancer or polyps, chronic inflammatory bowel conditions like ulcerative colitis or Crohn's disease, a diet heavy in processed meats and low in fiber, smoking, excessive alcohol use, obesity. If you recognize yourself in 2 or 3 of those, screening is not optional, it is essential. And the screening itself, the colonoscopy, is the single most powerful tool we have. It doesn't just detect problems, it prevents them. Polyps found during a colonoscopy can be removed on the spot before they ever develop into cancer. No other test does that. I'm not saying this to scare you. I'm saying it because early detection is the closest thing we have to a cure, and it starts with taking that blood seriously. Here's one that catches people completely off guard. Sometimes the blood in your stool isn't caused by a disease at all. It's caused by the medication sitting in your medicine cabinet. If you're over 60, there's a reasonable chance you take at least one blood thinner. Aspirin, warfarin, clopidogrel, or one of the newer anticoagulants like apixaban or rivaroxaban. These medications save lives. They prevent clots. They protect against stroke. I have prescribed them, I have seen them work, and I believe in them. But they come with a trade-off that not enough people are told about clearly. When you thin the blood to prevent clotting, you also make bleeding anywhere in the body more likely and harder to stop, including in the gut. Then there are NSAIDs, ibuprofen, naproxen, the pills millions of people take regularly for joint pain or arthritis. Taken occasionally, they're generally fine. Taken daily over months or years, they can quietly erode the lining of your stomach and upper intestine. That erosion leads to small ulcers. Those ulcers bleed. And because the damage happens gradually, most people have no idea until they see it. Even certain supplements can play a role. Fish oil in high doses, vitamin E, ginkgo biloba, these can all increase bleeding tendency, especially in combination with prescription blood thinners. Most people never think to mention their supplements to their doctor. That's a mistake. Now I want to be very clear. The message here is not to stop your medications. Never do that without talking to your doctor. The message is this: your medication list may be part of the picture, and when you report blood in your stool, mention every single thing you take. Every prescription, every over-the-counter pill, every supplement. Let your doctor see the full picture. That's how the right answers get found. Now I want to give you something concrete. A clear set of signs that mean you need to see a doctor, not next week, not when it's convenient, but now. Most of the time, blood in the stool is not an emergency. I want you to hear that. A small amount of bright red blood after straining is in most cases a hemorrhoid. It's worth getting checked, absolutely, but it doesn't require a trip to the emergency room at midnight. However, there are specific situations where waiting is not an option, and I want you to know exactly what they are so you never have to guess. If you see a large amount of blood, not a streak, not a spot, but enough that the water in the bowl turns red, that needs immediate attention. If the blood is accompanied by dizziness, lightheadedness, or fainting, that suggests you may be losing blood faster than your body can compensate. That is urgent. If your stool is dark, black, and tarry, that melena we talked about earlier, get to a doctor that day. That means bleeding higher in the digestive tract, and it needs to be found. If you're experiencing blood along with severe abdominal pain, or if you've noticed unexplained weight loss over the past few weeks alongside bloody stool, those are combinations that your doctor needs to evaluate promptly. And if your bowel habits have changed suddenly and stayed different for more than 2 weeks, more frequent, less frequent, a different consistency, along with any blood at all, that pattern deserves attention. Write these down if you need to, not to create fear, but to create clarity, because clarity is what saves time in a doctor's office, and sometimes time is everything. These signs mean your body is asking for help right now. Listen to it. I know why some of you haven't gone to the doctor about this. It's not because you don't care. It's because the idea of that appointment feels uncomfortable, embarrassing, maybe even frightening. You don't want to talk about it. You definitely don't want anyone examining you there. I understand that completely, but I want to walk you through exactly what happens because the unknown is almost always worse than the reality. The first thing that happens is a conversation. Your doctor asks you questions. When did you first notice the blood? What color was it? How often? Any pain? Any weight changes? Any family history? That conversation alone gives your doctor an enormous amount of information. You'd be surprised how much can be determined before anyone touches you. Next, a physical exam, possibly a digital rectal exam, which takes less than a minute and is far less uncomfortable than most people fear. Then, depending on what your doctor suspects, blood tests. These check for anemia, which tells them whether you've been losing blood slowly over time, and for signs of infection or inflammation. And then there's the colonoscopy. This is the one people dread, so let me tell you what it actually involves. The prep the day before is the hardest part. You drink a solution that clears your system completely. It's not pleasant. I won't pretend it is. But the procedure itself is short. You're sedated. Most people don't remember it at all. A thin, flexible camera goes through the colon. Your doctor sees everything directly, and if there are polyps, they can be removed right there. The whole thing is usually over in 30 minutes. Almost every patient I've spoken to afterwards says the same thing. That was it? I worried about that for months? The fear of the test is almost always worse than the test itself, and the information it gives you is worth more than anything I can tell you in a video. We've talked about causes, we've talked about warning signs, we've talked about what your doctor can do. Now I want to talk about what you can do. Every single day, starting tonight. Because here's what most people don't connect. The health of your gut lining, The strength of those blood vessels in your intestinal walls, the balance of bacteria in your digestive system, all of it is directly shaped by what you eat. Not occasionally, constantly. Every meal is either protecting that lining or quietly wearing it down. A diet high in processed foods, refined seed oils, excess sugar, and low in fiber creates an environment inside your gut where inflammation never fully settles, the lining stays irritated, the tissue stays fragile, and the conditions that lead to bleeding, whether from hemorrhoids, diverticular, or something more serious, they develop faster. Fiber is the single most protective thing you can eat for your colon. Vegetables, fruits, whole grains, legumes. Fiber keeps things moving, which reduces straining. It feeds the beneficial bacteria in your gut that maintain the intestinal wall, and it helps your body process waste the way it was designed to, smoothly, without pressure building where it shouldn't. Hydration matters just as much. A dehydrated gut is a sluggish gut. Sluggish transit means harder stools, more straining, more pressure on those already fragile walls. The changes don't have to be dramatic. Eat your vegetables first at every meal. Reduce processed meats. Increase fiber gradually. Not overnight, your gut needs time to adjust. And drink water consistently throughout the day, not just when you're thirsty. Your gut has been processing everything you've eaten for your entire life. 60, 70, 80 years of work without a single day off. Give it something worth working with. Let me bring everything together. Because I don't want you to leave this video with a vague sense of worry. I want you to leave with a plan. 5 habits. Simple, clear, and proven to protect your gut after 60. 1. Get screened. A colonoscopy at the intervals your doctor recommends. Not when you get around to it. Not when something goes wrong. On schedule, no excuses. It is the single most effective tool for preventing colorectal cancer, and it takes one afternoon every few years. That's all it asks of you. 2. Eat fiber-rich foods every day. Vegetables, fruits, whole grains, legumes. Your colon was built to process fiber. When it doesn't get enough, everything slows down, pressure builds, and the problems we've talked about today become far more likely. 3. Stay hydrated, especially if you're on medications that affect your gut. Water keeps things moving, it softens stool, it protects the lining. It is the cheapest, simplest thing you can do for your digestive system, and most people over 60 aren't drinking enough of it. 4. Know your medications and their side effects. Every prescription, every supplement, every over-the-counter pill. Know what they do, know what they can cause, and make sure your doctor knows everything you're taking, the full list, not just the ones you think are important. 5. Don't ignore changes. Any new or persistent change in your bowel habits after 60, frequency, consistency, color, discomfort, anything that wasn't there before and doesn't go away within a couple of weeks deserves a conversation with your doctor. Not a Google search, a conversation. That's it. 5 things. You don't need to be a doctor to protect your gut. You need to pay attention, ask questions, and take action. Now, I want to leave you with something practical, something you can start today. We've talked about inflammation throughout this entire video, how it weakens the gut lining, damages blood vessel walls, and creates the conditions where problems develop silently over years. We've talked about how what you eat either fights that inflammation or feeds it. That's exactly why I want to tell you about Cardio Slim Tea. This is a natural blend of 15 plant-based ingredients that many of you will recognize from this channel. Hibiscus flowers, beetroot powder, green tea, ginger root, hawthorn berries, curcumin, chamomile, every one of them chosen for a reason. Together, they support healthy cardiovascular function, promote normal homocysteine levels, and help reduce the kind of chronic inflammation we've been talking about today. No artificial chemicals, no stimulants, not habit-forming. It's manufactured in an FDA-registered, GMP-certified facility with third-party testing for purity. Every ingredient is plant-based, soy-free, dairy-free, and non-GMO. People who drink it consistently tell me they notice a real difference in their energy, their mood, and their overall well-being. 3 to 4 cups a day. That's it. Right now, there's a special discount available on the 3- and 6-month packages, which also include free shipping and 3 bonus guides. Here's how to get it. There's a link on my channel page. If you're watching on your phone, tap my profile picture to go straight to the channel page. A screenshot will appear on screen right now showing you exactly where to find it. If you're watching on a bigger screen, a QR code is about to appear. Just open your phone camera, point it at the square on screen, and tap the link that pops up. Your heart and your gut are more connected than most people realize. Taking care of one means taking care of the other. This is one simple habit that supports both.